pediatrics, 4th years case, and it reads: a 10-year-old male presents to the emergency department with a 1-day history of vomiting, lethargy. She has a previous history of excessive thirst and frequent urination. The vitals on presentation are 37 degrees Celsius, heart rate of 110, respiratory rate 25, your blood pressure 99/65, the weight is 30 kg. Then the labs were done, the pH was 7.05, your partial pressures for carbon dioxide was 20, then your partial pressures for oxygen were 100. Then you also have urine which showed glucose 4 plus and ketones 4 plus. So the first question is saying, what is the most likely diagnosis? B, the risk factors associated with this condition. Then C, you assess the child and find that he is severely dehydrated. Calculate the fluid requirement of this child for marks. Then D, outline the principles of management of this condition. Then lastly, give 2 complications of this condition. So if you go through this, so this patient has history of vomiting and lethargy. She also has excessive thirst and frequent urination. So we have our polyuria and our polydipsia. Then we also have vomiting and being lethargic. Then on the lab values there, according to our diagnostic criteria, we have the acidosis there. Also, the analysis is showing glucose 4 plus and ketones 4 plus, which is a typical diabetic ketoacidosis case. So on the diagnosis, this is just a diagnosis, diabetic ketoacidosis, and we haven't been told whether this patient is a non-diabetic or not. So in order maybe to not lose mark, you can say this is just a case of diabetic ketoacidosis. Then B, the risk factors, we mentioned the 6 I's. So you have your insulin, your infections, your infarction, your intoxication, your iatrogenic, I think we've mentioned most of the things. So maybe to expand, you can say those who are missing insulin therapies, intercurrent infections. You can also put your intoxication to say maybe if the child took some drugs, but this is most likely. So the ones we can go for in this case will be insulin, which will be an unknown diabetes and compliant to medications. Then also have infections, intercurrent infections. Then we can also, I think these are some of the major things for this case, a pediatric case. So take note of those 4 as our main things for this one, for this kind of presentation, because this is how the child is presented with. C, so for part C, we are going to do on the next slide. So let's go to D. Outline the principles of management for this condition. So they just want the principles. So what are some of the principles of management? So again, depending on how you want to phrase them, so you can say your supportive therapy. 1, you can also do your insulin administration, your IV fluids. You also say you can treat underlying cause. Then you do your monitoring. And lastly, the potassium replacement. So let me just repeat. We have our supportive therapy, your potassium replacement, your IV fluids, your insulin administration, treat the underlying cause, and you monitor the patient. I think these are the principles. Since you just want the principles, not the exact way of managing the patient. Then complications, they just want to, so we can pick from those. So we had cerebral edema, your acute respiratory distress, if you remember, we had deep vein thrombosis, your acute circulatory failure, your coma. And even though it's rare, you can also put your DIC, which is your disseminated intravascular coagulopathy. Then let's go on the next slide. We do part C. So part C is saying you assess the child and find that he is severely dehydrated. So the question is saying calculate the fluid requirement of this child. So just calculating the fluid requirements. So we have in pediatrics is fluid deficit, which is equal to percentage of dehydration times the body weight. So in severe dehydration, the percentage for the dehydration is 10%. So we are going to use 10% times the body weight, which is 30, and the answer should be in liters. So 20% times 30 is going to give us 3.0 liters, which is equivalent to 3000 mils in 48 hours. Then, since we are going to first start giving in 24 hours, so we are going to give half of that, which is 1500 mils in 24 hours. Then your fluid maintenance is, we use the Ori-de-Segaru method, Ori-de-Segaru, which is 150-20 rule, where we multiply the first 10 kg with 100, giving us the 1000, the second 50 mils with 10, which is 500, then 10 mils, which is 10 mils times 10, which is 100. So that's like, so it's going to give us 1700 in 24 hours. So therefore the total amounts of fluids to be given over 24 hours is the first 1500 we had plus the 1700, which is going to give us a total of 3200 in 24 hours. So we can even, so I think we can end here, because if you want, we can even explain further to explain how we want to be given exactly. But I think there is another point I put, an extract I extracted from the local guidelines here. So let's go on the next part. So this is the draft, which is for the fluid replacement and maintenance and deficit in DKA in pediatrics. So fluids, the requirements in, so the this question asks about the requirements. So the requirements is just the maintenance plus deficit. So that's it. So that's the requirements. Then there is also deficit. So how do we calculate deficit? Percentage of dehydration times the body weight. Then the maintenance, I said we use the Ori-de-Segaru method. So your 100 mils times kg, your first 10 kg, and your 50 mils per kg, the next 10 kg, and your 20 mils per kg for every kg thereafter. Then add deficit and maintenance and give over the next 36 to 48 hours. So there is an example there. So for a 25 kg diabetic patient, fluid is calculated as follows. So for the deficit, most of them are severely dehydrated, so use 10%. So 10% times 25 is going to give us, so we usually get 2.5, but the 2.5 is in liters. It's not in mils. Don't make a mistake of having it in mils. Yeah, most people do that because it's just not even mils. Sometimes what they do is 10 times 25 is just 250. Then 250 what? Mils. But that's not it. It's 10% times 25 is going to give you 2.5. Now the 2.5 is not in mils. The 2.5 is in liters. So what's 10%? So if you just calculate, just do the math now. So 10% is 10 over 100. So 10 over 100 is, so 10 over 100 times 25. So 10 times 25 is going to give us 250. Then 250 divided 100 is going to give us 2.5. Then 2.5 is not in mils, is in liters. So that's where the 2.5 liters was coming from. Then which is equal to 25, which is equal to 2500 mils, and should be given over 48 hours. So what we do, we get half of that, which is 1250, and we give it over 24 hours. Then the maintenance part, we do our 150-20 rule, where we get 1500 and 100. So we just multiplied the first 10 kg, the second 10 kg, and the last 5 kg. So we have 1600 per 1600 mils per 24 hours. So we're just going to add 1600 mils plus the 1250 mils we had, which is that's what we are going to give over 24 hours. And we can even, this it's even saying this may be divided by 3 or 4 to be given at 950 mils 8 hourly or 710 mils 6 hourly respectively. And the type of fluid is 0.9% normal saline, and you may change to DNS once RBS has fallen around 12 millimoles per liter. So that's from the protocols. Otherwise, this is the end of the tutorial. Thank you for watching. Please like, you comment, you subscribe, and if at all, you may also comment on how we can improve on our channel. So since we have more contents coming on the way, how we can improve, feel free to contact us, even just comment on the comment section there. We also have our number on our info on the channel, so feel free to contact us and how we can improve this channel, because we are here to stay. Thank you so much. Please subscribe, share this video, comment. Thank you.